Kia ora koutou katoa, good afternoon everyone. This week I'm in the House on Tuesday and Wednesday. On Thursday I have the privilege of presenting the 2022 Ryman Prize here in Wellington, a healthcare award for the world's best development, advance or achievement that enhances quality of life for older people. On Friday I'll attend the New Zealand-China Council AGM to mark our 50th anniversary of diplomatic relations. On the government agenda this week, we have the final Commerce Commission market study report on building products. This began in November last year as we pulled all levers to ramp up New Zealand's house building program. And we've already instigated improvements in supply, including the broader availability of plasterboard. We also have the introduction of the Sale and Supply of Alcohol Amendment Bill, which gives communities greater powers to reduce alcohol harm locally. We have an event to mark 100,000 retrofits to make Kiwi homes warmer. And of course, the result of the Hamilton West by-election will be announced on Saturday. Today I can confirm that Cabinet has agreed to hold a Royal Commission of Inquiry into the COVID-19 pandemic response to better prepare New Zealand for future pandemics. It will be chaired by Australian-based epidemiologist Professor Tony Blakely, alongside two members, former Cabinet Minister the Honourable Hekia Parata and former Treasury Secretary John Whitehead. Each brings a unique set of skills and importantly are independent of the government and its response. Professor Blakely's understanding of public health is extensive and he has the knowledge and experience necessary to lead this work. The Honourable Hekia Parata and John Whitehead would add expertise and bring useful perspectives on the economic response, the response for Māori, and also a useful education lens. The terms of reference are being approved and the Royal Commission has been asked to look at the response, identify what we can learn from it and how that can be applied to any future pandemic. The scope of the inquiry is wide-ranging and will cover specific aspects of our health response, such as our border, community care, isolation, quarantine, as well as the economic response, and that does include broadly monetary policy. We'll not consider individual decisions, such as how policies applied to an individual case or circumstance. We'll also look into the effectiveness of our strategies, including elimination, minimisation, and protection. And it will cover the period of the response from February 2020 to October 2022. The Royal Commission will begin considering evidence from the 1st of February next year and conclude in mid-2024. A report will then be prepared which will help inform any future government's pandemic response. A Royal Commission of Inquiry is the highest form of public inquiry, and it's the right thing to do, given the COVID emergency was the most significant threat to the health of New Zealanders and our economy since World War II. It's fair to say that New Zealand's COVID-19 response has already been heavily examined, both internationally and nationally. So far, 75 reviews have been carried out within New Zealand since 2020. Internationally, New Zealand has been named as having the lowest cases and deaths in the OECD for 2 years in a row, the result of our decision as a government and as a country to go hard and early, and the commitment of many New Zealanders to protect lives and livelihoods. However, we said from the outset that there would be an appropriate time to review our response, to learn from it, and with the emergency over and our primary focus on our strong economic recovery, that time is now. We had no playbook by which to manage COVID, but as a country we united in an extraordinary way, and we did save lives and livelihoods. But ultimately, the Royal Commission is an exercise in ensuring we have the strongest possible playbook in the event of a future pandemic. I have Minister Dr. Viral here, who is the Minister for COVID-19 response, to also assist with any questions that you may now have.